Take one.
I think the instigators were really Annie Wohlgenaut, Barb Jandorf, and Marcy Morrison.
The project officer in charge of healthcare at the Rose Community Foundation was Annie Wohlgenaut, and I was a consultant, but she and I had worked together on a number of projects. It was sort of a joining of the minds about both of us from different perspectives, the foundation and me as a consultant saying there's some missing things in the community and what can we do about it.
The idea was we should have some kind of an institution that everybody could trust, that had credibility, that could, be the source of information, and then could help us understand what that meant and what there was to be done about it.
We talked to our board at Rose Community Foundation, and they said, this is interesting. Why don't you see if people are interested, if there is an interest, if we're the only one interested, who else is interested? And we got in touch with the Caring for Colorado that was recently formed, and they were interested in doing the feasibility study with us. So that's how it began.
I arrived in October of 2000, and our board had just received the feasibility study result that Barb Jandorf had done. And prior to my time, our board had had some similar conversations. So our board was really enthusiastic, and as they read the report, the board decided we should pursue it one step further. So that's when I had a conversation with Sheila, and we decided that it was only appropriate to ask the Colorado Trust, the other major health foundation at the time, if they were having similar thoughts and if they were interested. So I then made contact with John. I guess we both made contact with John, and then he came to the table.
One take I had on it, and why I thought it really had a lot of importance, was that the three of us had often been reminded that our role in this community was to collaborate, and it was easy to say but hard to do, and this seemed like a perfect opportunity.
So we were very pleased when we hired Pam Haynes.
It was a vision that was very consistent with my own values and my own desire to influence policy in a positive way that didn't include spin, but really was based on evidence. And so actualizing the vision of the three foundations was real easy for me to do because I shared it.
I've been at CHI for 7.5 years.
And I have been at CHI for 7.5 years as well. In fact, I think I beat Amy by a week, starting back in 2005. I think one of the most gratifying things for me is to talk to our constituents. I get a lot of requests for information and requests to get connected up with different types of resources. And for me, talking to people and hearing how we assisted them in getting connected to data or resources is one of the most fulfilling things.
There are no preconceived answers to the questions that we're trying to answer. We're using evidence and analysis, and there's a lot of intellectual freedom in that.